Hotshot time. Let's break down 5 crucial respiratory nursing exam questions. Question 1. A patient with severe asthma stops wheezing and becomes drowsy. What's happening? Impending respiratory failure. Prepare for intubation immediately. No wheezing means no air moving. Question 2. What's a safe saturation range for COPD patients to support their hypoxic respiratory drive? 88 to 92%. Start low and go slow with oxygen for COPD. Question 3. A patient with a recent self-administration of an opioid like fentanyl presents with a respiratory rate of 4. What's your intervention? I hope you got it. It's Narcan now. Opioids relax you so much you stop breathing, you need naloxone A Narcan stat. Question 4. Why shouldn't you lie a pneumonia patient flat? Because of the risk of aspiration pneumonia. Always encourage upright positioning, deep breathing, and early mobility. Question 5. What's the gold standard for diagnosing a pulmonary embolism? CT pulmonary angiography and AV/Q scan is the next best choice. Yes, you can master respiratory nursing.